We're going to be talking about our spinal health series that we are beginning in April here at Awakened. And so we're going to get started with David. David, tell me who you are and what brings you here.
Thanks, Caroline. So I'm a craniosacral therapist and a massage therapist. I also practice polarity therapy, and I'm looking forward to working with Caroline in her class on spinal health. So my background is that I come from Colorado and San Diego to here, and I've studied craniosacral therapy since the year 2000. So I put in at least 2,400 hours on it, and only recently have I started Upledger craniosacral therapy. Before that I studied biodynamic, and so my aim is to create an atmosphere where the craniosacral rhythm can be felt by the client and by me and by anyone else in the room. That's what I'm doing.
Great. And what would you say is your target population or your favorite population to work with?
Yeah, I work with all ages, from infants to as old as you can get. And my favorite target population is infants, but I don't have that much business with them. Infant mother bonding is a particular specialty for craniosacral therapy. But most of my clients are older, 30s, 40s, 50s, and they come to me with PTSD or migraines or trouble sleeping or trauma.
And would you say that when you see people that are in the older age brackets that you help them feel some sensation of being in the womb, or there's some relation there?
Yeah, there is. So craniosacral therapy is based on osteopathy, and it's hands-on palpitation, but it's very light touch. And the idea of it is to feel the rhythm in the spine. There's a continuity between the cranial bones, the spine, and the sacrum, and they all move in a slow rhythm, about 6 times per minute. And that rhythm is something that the preborn baby is familiar with in the womb and can feel it, and it's soothing, and it helps the infant adjust to any kind of stress that they might feel, usually from the mother. So that kind of soothing feeling is forgotten by the conscious mind when the baby is born, or soon after, maybe 1 year old, 2 year old at the most. But they can access that if they can remember it unconsciously. So the therapist helps them to remember that rhythm unconsciously. We don't deal with the conscious mind at all.
And so, thinking about offering services to adults, what is the physical benefit that somebody might achieve, or what type of activation in the spine would one might expect with cranial?
Good question. When you're feeling the rhythm unconsciously, and sometimes the client's actually sleeping during the treatment, when you're feeling that rhythm unconsciously, it'll start to unwind your spine, and the unwinding will go throughout your whole nervous system until it reaches every part of the brain, every part of the spine, and then onto the joints and the chakras. and it's the soothing rhythm unwinds wherever you need to be unwound, and that, so it's kind of a one-size-fits-all therapy, where the anxiety is, wherever it is in the body, wherever it's felt in the body, the rhythm tends to relieve it. Yeah.
Great.
So, like I said, it's good for migraines, it's good for accident trauma, it's good for trauma that's emotional, sexual abuse, other kinds of physical abuse. There was a man that I treated who his father repeatedly choked him as a child for years, and he's just now learning how to breathe.
Wow.
And he's 35 years old. So
amazing.
It helps with all that trauma, and it helps because it suggests a soothing rhythm.
Cool. Interesting. What I'm feeling actually with what you were saying is the breathing and the Aldoa modalities that we are doing in conjunction with the cranial light stuff actually activates the spine in a similar way because it starts to relax it a little bit. And so the conjunction of the therapies is amazing.
Yeah, they're really synergistic.
They are. It's I can feel it as we're talking about it, just like the palpation of the spine and the way that it uncoils, and you get those same type of similar releases when you're doing Aldoa. And so I feel like if you're practicing cranial light therapy and Aldoa at the same time, you can get like one of the deepest releases that you can find.
Yeah. It's like I said, an unconscious process, and it unnerves the past. So it takes you back to trauma, and that memory can be painful, but I believe strongly that going back and feeling when the trauma was is the best therapy. There's a lot of different psychologists and somatic release theories and practices, but lots of them believe this, that accessing the experience and making it possible to relive the experience without the immediacy of the body will freeze, or parts of the body or the parts of the spirit will freeze when the trauma is happening originally, because there's a coping mechanism that comes in.
Sure.
Yeah, and so, but when you access it later on, either as an adult or older adult, you have the ability to feel what you couldn't feel then.
Sure, and you offer such a safe space for people to do that.
Yeah.
And it just, I feel, opens them up to achieve a deeper sense of relaxation and maybe even a deeper sense of sensing of their self.
Yeah. While we're on that subject, do you want to tell a little bit about yourself?
Sure, yeah. So I'm Caroline. I'm an Aldoa Level 2 instructor. I'm a certified personal trainer, a registered nurse, and an energetic practitioner. I have been nursing for about 11 years and practicing here in Albuquerque the entire time. It's been amazing. In New Mexico. I have pretty much been raised here, so I'm deeply entrenched in the community. I have been practicing Aldoa for about 6 years now, and fitness training, and I've combined all of these modalities together to kind of form my own practice. And so I use a little bit of stuff from Aldoa and my nursing background and the fitness background, and the energetic realm, and I just kind of put it all together. And so I'm really excited to be talking to you about the cranial light and all of that in relation to what I do.
Caroline, when did you know that you wanted to do this sort of work?
Oh,
I mean, you were a nurse first.
I was a nurse first, yes. It was when my dad passed, to be honest with you. I lost him in a traumatic sense and did a little bit of soul searching, for lack of words, and started to really dive into meditation. And I always knew that I wanted to be some sort of fitness trainer or wellness practitioner, though. It did, however, take something like that to really ground me in the energetic practice. And after taking some of those courses, I knew I was meant to be doing this.
How did taking the courses and switching gears, how did that help you?
Perspective. It gave me a totally different perspective, especially of the body. I was a nurse for such a long time. I feel like I had this foundational, educational foundation of the body, the anatomy, and the pathophysiology of it. But I never really felt my body or knew how to feel the body. And then I started diving into meditation and energy work and started to develop this sense of self. And I could, I guess we called them feelings at the time, because there was all these emotions from before that were coming out that I didn't even understand what those feelings were. And so doing some of the energy work helped me ground in what they were, and that just opened so many doors. Because I was feeling things that I didn't know what they were. Like, I was mad about something, but I didn't even realize that I was mad because I just wasn't feeling after the passing of my father.
Well, speaking of feeling, I've noticed during your therapy that you make small, in addition to the breath, the breathing, and the training aspects of what you do, you make small, you touch people on the spine and the joints with very light touch, similar to craniosacral actually, and you somehow transmit a calmness to the person that you're working with, and it allows them, because this is my own experience, it allows them to feel the whole influence of the exercise from top to bottom, or to feel it in their body, like the breathing from the bottom of the spine to the top, but as a whole, instead of getting lost in the details. There's like a wholeness to it. Do you feel that as the practitioner?
I do, and I just know where to touch, or I just can see or feel what aspect of the body may need support and may need some sense of reminders to where it should go. So for example, if we have a shoulder that's rolled forward, and I just know and can feel that it needs to roll back and open up, I can support or offer some sort of energetic support to that realm of the body. But I'm always seeing the body as a whole because everything talks to each other. And so even energetically, you think about the energy systems and how we take in energy or let energy leave out of the body. It's just so interconnected. It's never just the shoulder that needs the love, right? It's the hips that need the love too, in order for the shoulder to remember where to go.
Yeah, I had a yoga teacher many years ago, and we were doing I think it was down dog, I think. And she would she'd reach under your ribs and lift you up so that you were straight.
Sure. But
then she said, just imagine when I'm not there that some crane is lifting you up. So with your practice, it feels like you're pulling from your vantage point as the practitioner. You're helping to pull the spine straight in an energetic way. I can't explain how you do that, but that's what it feels like.
Oh, I love the feedback, and I have no words sometimes. I don't even know it. It is like you know what was speaking to me when you were talking about how cranial light gets in there and just uncoils the spine,
Unwinds, yeah.
unwinds the spine. I feel it's the same concept when I practice. It's more like where does it need to be uncoiled? Like where is this energetic stickiness, or where is that at? And that's where we need to support it. But it's not that area necessarily that needs the love or the support. It's definitely some more supporting structures. And then with the Aldoa, when we get in there and we're actually opening the articulations with these poses, as you know with cranial light, I'm sure some of these emotional things and they get stuck in the spine, and it's almost like they come together to just activate that area that needs to open up so that it can do what it needs to do. And so if cranial light's not getting in there because maybe it's too emotional for the patient or for the client, with the Aldoas and the breathing, we can get in there and manipulate it in a little bit of a different way, and then you go back in there with a cranial light and it remembers how to uncoil.
Yeah, that's a really interesting concept. I know as a client for your work, I feel like there's some kind of unwinding going on, just like with the cranial sacral work. But it's almost like the client needs to pay attention in your work. They need to pay attention to so many things at once that their mind turns off.
Right.
And they're no longer worried about one thing because they're trying to think of doing the breath, the movement, the heels, the spine, the top of the head, the kegling, all that stuff at once. So their mind switches off, and they go with kind of a feeling or a light. It's almost like a light comes on, and they're going towards the light. That's how I feel.
It's like it's the space, and then your mind's off, and we can energetically pull the spine open. That's exactly right. It's like
That's
the
exactly
shut off.
right.
Yeah.
Well, I don't know what else to say.
I know.
I think we're done.
I think we did good.